I'm Laura Magson. I'm a solicitor in the Mesothelioma and Asbestos Disease team at Boys Turner. Many thanks for joining us today. We normally hold a study day every 12 or 18 months or so for mesothelioma and asbestos-related lung cancer. This year, of course, it hasn't been possible to do that, so our speakers have kindly agreed to carry on and present via a short webinar instead. I'm joined today by my colleague from Boys Turner, Jemma Garside, who is an experienced solicitor dealing with community care. She assists individuals who are disabled and their families, assisting them with their care needs. Many thanks, Jemma, for agreeing to carry on and speak to us. I'll hand over to you now and you can tell everybody what you're going to be presenting about.
Thanks, Laura. I'm going to be talking today about statutory funding for social care. So that is getting funding from a public authority to pay for one's care needs. The topics I'm going to cover today in my talk are as follows. I'm going to talk about the two different types of public funding that are available. That's support from a local authority or support from the NHS. And I'll talk about the main differences between the two of those, and also the kind of support that you can get if you're determined to be eligible to receive that kind of support. I'll look into how one can access that funding, what the procedure is that the authorities must follow, and that's in terms of an assessment of eligibility. And once you have been assessed and a decision is made, then I'll briefly cover what will happen in terms of care planning. What will be your package of care? How will that be put together? What the process is for that. And then at the end, if I have time, I'll briefly cover some common issues that can arise, and there'll also be time for some questions. So firstly, the difference between local authority and NHS funding. As you can see here, I've firstly looked at local authority funding. This is care that will be funded by a social services department at your local authority. What they will do is they will allocate a social worker who will assess your needs under what is known as the Care Act. This is quite a new piece of legislation that was brought in 5 years ago, and this provides a very detailed description of what local authorities must do when assessing individuals in their area who have a need for care and support. They have a duty to those people, and the Act makes it very clear what they must do for those people, determining whether they're eligible for assistance and how to provide that support once they are eligible. What the Care Act says is that an individual must have a need for care arising from a disability, physical or mental illness. And I think one of the key differences between local authority and NHS continuing healthcare is the financial aspect. With local authority care, if your funds are over a certain threshold, then you will not be eligible for assistance from the local authority. They can actually now, under the Care Act, implement a care package for you and you pay for it, but you could potentially have to pay for all of your care package. Even if you are financially eligible, with local authority care, it's very likely that you'll need to make a financial contribution towards the cost of your care. So they will assess what your weekly income is based on your benefits or your pensions or your income, and they will look at all of your expenditure and they will work out how much you can afford to pay to contribute towards the cost of your care. I could speak about that for another hour, but that is just a brief overview of a financial contribution. With NHS continuing healthcare, this is care that is arranged and funded solely by the NHS. often people think that that just means it's care in a nursing home or in a residential placement. But NHS continuing healthcare can be provided in the community. But the key factor here is that the person must have what is known as a health-related need for care. So really, it's very specialist and health-related care that a person needs. And I'll go on to explain that in a bit more detail later on. As you can see in the bottom corner, I've just mentioned about personal budgets and direct payments. For both local authority and NHS care, a personal budget can be allocated, which is where you are given the budget. You're told how much you can spend on your care, and that is paid to you to then have the flexibility to arrange for your care as you may want to have it done. Turning to the next slide, what kind of support would be available when we talk about statutory funding for care? What do we actually mean by that? I think the focus of my talk today is going to be on care, and that could either be care at home or a care in a specific setting, like a care home. Where you have care at home, that's going to be provided to you at set times or hours, and you can have a carer who would assist you with personal care. But it's important to distinguish that from home help, which is somebody that would help you with more domestic tasks. You may not be able to carry out things like, vacuuming your carpets or cleaning your bathroom because of your disability, but that needs the care and support that you need to fulfill those tasks must be distinguished from the care and support that you'll need to carry out personal care tasks such as dressing, washing yourself, etc. I've not mentioned here, but care support can also include things like equipment. You might need a hoist, you might need adaptations to your home. These are all things that can be provided through statutory funding. That could also include therapies such as speech and language therapy or counselling, and also other kinds of advice and assistance. As you can see here, care at home has been described, but also there is, it's important to look at the difference between care home accommodation, as it's not always just nursing care. It can just be residential care where you have carers on hand, whereas in a nursing home, you must have a need for nursing care. So you might need regular injections, you might need your medication prescribed to you and given to you in a certain way. You might have pressure sores that have to be dealt with. So for more complex and specific needs, it's likely that you would need nursing care. Another option as well with a placement would be supported living. This could be where you have your own flat, but it is within a community setting where there is staff on hand to support you as and when needed. So you might have a bell perhaps, and there is somebody in the reception of the building that can come and support you if there is an emergency. Turning to the assessment of eligibility. With NHS continuing healthcare, it's likely that you may have been in hospital, but a GP can also make a referral for NHS continuing healthcare. And eligibility was not simply determined by a diagnosis. It is about your health-related needs. It's a two-stage process. Firstly, a checklist will be completed. This is very quick. And if you satisfy the checklist, you'll then have a more detailed assessment, which is through a decision support tool, and it's often referred to as a DST. Following the completion of the decision support tool, a recommendation would then be made as to whether you're eligible for support, which would then lead on to the care planning process. With both the checklist and the decision support tool, the care domains that are assessed are the same, and they're here in this list that you can see on the screen. I put a star by the 4 key domains. If you are found to have a need in just one of those areas, you'll automatically pass the checklist. So the checklist, you can score an A, a B, or a C in each of these 12 domains. A is for high, B is for moderate, and C is low or no needs. If you have 2 or more A's, then you will pass on to a decision support tool. But as I said, if you just have 1 A in one of those 4 areas, you will also go on to having a DST. The decision support tool will then mean that a multidisciplinary team, which is led by a nurse assessor, will go through each of these domains with you. And there's a much more detailed eligibility criteria. Your needs would either be no needs, low, moderate, high, severe, or priority in these 12 areas. And I'll go on to explain how a person can be found to be eligible after these 12 domains have been considered. As you can see, a recommendation of eligibility would be expected if you have a priority need in one of those 4 levels on the previous page where there was an asterisk, or if you have 2 or more incidences of severe needs across all of those 12 domains. You may be eligible if you have 1 domain recorded as severe together with a number of other domains, or a number of domains with high and or moderate needs. What I must be clear about here, though, is just because you have maybe a priority need in one of those areas, the guidance says that you would be expected to have a recommendation of eligibility, but it's not that you definitely would be, because what will then happen is they will look at your needs in the whole to determine whether they're of a nature, intensity, complexity, and unpredictability that requires primary healthcare rather than support which social services could provide. That leads me nicely on to an assessment of eligibility from a local authority. It may be that, as I said before, your GP makes a referral for social services support, but this is something that you could actually do yourself. Every local authority has information on their websites or in their council offices about getting support from social services. So these assessments now can even take place over the telephone. So just because we are in the midst of a situation where you may not necessarily be able to meet a social worker, you can still have an assessment. I've set out here the outcomes that will be looked at. So in an assessment, the social worker will be recording the impact on your well-being of being able to achieve these outcomes or indeed not. So if you require assistance in 2 or more of these areas, you would be expected to be eligible for support. What I mean by requiring assistance is that you're not able to achieve one of these outcomes without support or without causing yourself damage or putting yourself at risk, or in fact, you're just not able to do it at all. If you, as I say, if you need support in 2 or more of those areas, then you will move on to the care planning stage. I've put the care planning stage for local authority and NHS together because this is very similar. It's a very similar process for both. So once you've been found to be eligible, the assessments are different, but the care planning is pretty similar. What will happen is that the professionals involved in your care will identify what it is that you need to meet your care needs and how much that will cost. It will then be recorded in a care plan, and the authority must take all reasonable steps to involve you. It may be that you have strong wishes to stay at home, and they must take into account your wishes during the process. It should be very flexible, and everybody involved should be able to feel comfortable in making suggestions. Once a care plan is in place, it must be reviewed regularly. What the guidance says for local authority support is that it should be within the first 6 months and thereafter annually. And with NHS continuing healthcare, that must be within the first 3 months and thereafter annually. As I've said previously, for local authority support, there will be a financial assessment. And however, if you are not financially eligible, they still can implement a care package for you. It's just that you would have to pay for it yourself. The care plan itself must describe what your needs are and how they are going to be met. It must set out a personal budget, so you and everyone else involved is aware of how much funds have been allocated to meet your care needs. That could be important because it may be that you would rather have a personal budget and employ your own carers rather than using a care agency that's been suggested to you by the local authority. It should also include advice and information about what could be done in emergencies and what can be done to prevent any deterioration in your condition. And if there's direct payments, it should explain how that will work for you. Common issues with statutory funding. I've put a list here. Obviously, if the local authority or NHS find that you're ineligible support, that would be an issue. There is an appeal process for both. With a local authority, you would ask them for a review, and that would be another assessment with another social worker. If you're not successful in that, then there would be a formal complaints process that can be followed. With the NHS, there is a more formal review process. Firstly, you would ask for a local resolution meeting, which is where you'd have a meeting to go through the outcome. And if that wasn't successful, you would have 6 months in which you're permitted to make an appeal to an independent review panel. As I said before, financial assessments. If the local authority find that you're financially ineligible, you could actually disagree with their assessment of your finances, or even you disagree that the contributions they've assessed you as being able to afford to make are not actually affordable to you. You could have concerns about the adequacy of your care package. It may be that you've only been allocated 1 or 2 hours a day, but actually you feel that you need maybe 5 or 6 hours of support per day. Delay is a common issue where assessments can take months, care packages can take months to be implemented. And direct payments do bring themselves a great deal of issues in terms of actually managing them and reporting to the authority. It's very important that if you are told that you're eligible for direct payments, that you make sure that you have as much information about them as possible so you can understand what is required of you, because the reporting procedures can be quite strict. So that is a brief nutshell of statutory funding for care. My details are here. And Laura, are there any questions?
Many thanks, Gemma. That's really, I think that's a really useful insight, and I'm sure that some of the patients and the professionals listening in will have found that really useful. I've just got a couple of questions. So you mentioned the eligibility, the financial eligibility. A common question that I'm asked from some of our clients is about what the threshold is, but also presumably any personal injury payments from the case. They might have a legal case going on, and that might then, settle or get an award. Is that disregarded from the eligibility criteria?
Thanks, Laura. That's a really good question. So your first question was about the financial threshold. There's two parts of the threshold. If you have over £23,250, you will have to pay for all of your care, up until obviously your funds are depleted below that amount. However, for every £1 that you have over £13,250, you will have to pay a contribution from your capital up until your funds are depleted below that 13,000 limit. So that's quite complicated, and as I said before, it's really important to make sure that this is explained to you properly so you understand it. In terms of personal injury payments, as with benefits, this is disregarded in the means test. It's very important that you make that clear to the local authority and that you ensure that you've complied with the rules in terms of maybe setting up a trust, or maybe you have a professional deputy dealing with that personal injury award.
That's really helpful. Thank you, Jemma. And another question is really some of the clients that we obviously represent, if they've been diagnosed with mesothelioma, they might be terribly poorly with a poor prognosis. Is there anything different that happens to people where they do have a limited life expectancy? Would your advice change in any way about what care package they get?
Well, there is guidance in place that says that where a healthcare need is very serious and very urgent, that the NHS continuing healthcare assessment process can be fast-tracked. So I would certainly recommend then a situation like that, that the person themselves or their family do ask questions about whether the fast-track procedure is appropriate.
Okay. Thank you, Jemma, and many thanks for sharing your time and your presentation with us this morning.
Thanks, Laura.